Hi, this is Dr. Martin and I will discuss the hip joint with you. We have the os coxae or the hip bone, and we have the femur. And remember, the hip bone or os coxae had three parts. The big large part we were calling ilium. In the back we have ischium, and we have the pubis or pubic bone in the front. So they fuse and becomes a one hip bone. And when we look the femur, head of the femur, and acetabulum of the hip bone, and when ball and socket form, when they come together, they form the hip joint. And hip joint, by function, is a diarthrotic joint. That means it is freely movable. And because it's a ball and socket type of joint and has a synovial membrane and synovial capsule and articular cartilage in the acetabulum, or we call labrum, and we call this is a synovial bone by synovial joint by structure. So synovial joint as a structure and diarthrotic joint or freely movable joint as function. And we see some ligaments. You can see this ligament attached to femur and then ilium portion. So we call this iliofemoral ligament. And we have ligament attached to pubic bone and attached to femur that we call pubofemoral ligament. In the back, in the anterior portion, you can see the ligament connects the ischium to the femur. So this is ischiofemoral ligament. Those are very strong ligament and binds the hip bone to the femur. There is one more ligament I can show you in this model. In the small model, you see when you take the head of by the way, the femur has an articular cartilage. Head of the femur has articular cartilage. It's color coded with blue, and you see the acetabulum has the labrum fibrocartilage, and it is represented with the blue color. And when I took you see the rope. This rope actually is not a rope in living person. It's ligamentum teres, and it's what it does, it contains a blood vessel, an artery to supply blood to the femur. Thank you for watching.